Treating chronic illness is not just as simple as taking supplements or infusions or even taking medications. There's always a deeper layer, and I think that 99% of practitioners out there are missing this. So stay tuned to today's episode to dive into this topic a little bit deeper. Welcome back to the Evolving Wellness Podcast. My name is Sarah, and today I have Dr. Bruce Hoffman here on the show, and we are going to talk a lot about what is commonly missed when it comes to patients with chronic illness. Now, Dr. Hoffman has been in practice since before functional medicine was really even a thing. He has worked with people all over the world. And now, after all of the years that he's been doing what he's been doing, he really only works with complex cases. You're going to hear in this conversation that he approaches things very differently than your average practitioner. And I think it's crucial. One of the things he said that really struck me was that he would not actually give anyone any sort of a treatment that is any sort of a supplement or even a medication until he has done some pretty advanced assessments when it comes to the nervous system and trauma. Again, I think this is crucial and being missed by a lot of practitioners. So I hope that this conversation brings light to a very important topic, and I hope you enjoy it. Make sure to head down to the show notes to get Dr. Hoffman's information, his links. If you want to follow him and check out some of his work and his book, I highly recommend it. And I hope you enjoy today's conversation. Today's show is brought to you by Upgraded Formulas. They have my absolute favorite magnesium. You can get the best and only clinically studied stabilized nano magnesium supplement on the market from Upgraded Formulas using my code YOGI for 10% off. Did you know that magnesium is actually required for over 800 enzymatic reactions in the body? This clinically studied magnesium has proven to improve sleep quality and energy by over 60%, specifically improving light sleep measurement by 90%, REM sleep by 150%, and deep sleep by 250%. That means more energy, better mood, and deeper sleep. Who doesn't want that? What makes this the best on the market? This specific magnesium is nano magnesium, which means it is easier for your body to absorb and use. In fact, it is absorbed up to 99.99%, which means you'll feel the results instantaneously. A lot of people are quick to talk about the benefits of sunlight, but what gets often missed in the conversation is the benefit of darkness and the importance of protecting yourself from blue and green light after sunset. That is why I choose Viva Rays as my go-to source for protecting my circadian rhythms. You can use the code YOGI to save 15% off at Viva Rays. Now, you may have seen some of these studies popping up. I call them fear mongering about blue blockers not being effective. And that is a partial truth, because when you use blue blockers that are clear or that have not been tested with a spectrometer to actually block what they say they do, they will not protect your circadian rhythms. And they are not catching those key wavelengths that you need to be blocking in order for your body to be able to repair, for you to make melatonin, which is a master antioxidant. And artificial light at night has been in the scientific literature extensively linked to a host of hormonal cancers, obesity, diabetes, and all sorts of metabolic issues. That, again, is why I choose Viva Rays as my go-to source for protecting my circadian rhythms to allow my body to get adequate darkness at night. You can use the code YOGI to save 15% over at Viva Rays, and you can actually trust that they block the frequencies of light that they say they do. Thanks to Viva Rays for sponsoring today's podcast. Hello, everyone. Welcome back to the Evolving Wellness Podcast. Today, I have Dr. Bruce Hoffman here on the show, and he has a long history of working with people with chronic illness. And I think that he has a little bit of a different point of view than a lot of the practitioners out there. So I'm excited to see where the conversation goes. Thank you, Dr. Hoffman, for being here.
Absolutely. Thanks very much.
Yeah. And if you wouldn't mind, just maybe tell my community here a little bit about yourself and your history and what you do.
Yeah, so I'm from South Africa and received my medical training in the University of Cape Town, Groote Schuur. and came to Canada at the age of 28 and went into rural practice, and then was inspired by many other doctors in the field at the time who were integrating concepts and spiritual systems and East-West methodologies into their traditional MD approach, and just became inspired. And first person I went to visit was Larry Dossey in the 1980s, and I think Larry's still around, but he wrote some amazing books, and he articulated these different layers and levels of healing and these different stages of evolution through, you know, physical medicine, mind-body medicine, and now what we call spiritual medicine.
Mm.
And on that model, I then studied as much as I could in Chinese medicine, Ayurvedic medicine, homotoxicology, you know, like we've all been through all these multiple trainings. And then slowly but surely developed a system of attempting to integrate the complexities of this human experience,
Mm.
you know, all the way from what I call illness to illumination. People present with all these symptoms and they want help. But very often those symptoms are teleological. They are attempting to provoke the individual who presents with a meaningful insight into what the symptoms may mean and what and how best to negotiate the minefield of all the complexities. So I eventually ended up developing a model based on the Ayurvedic concepts of the koshas, the different bodies of reality that the ancient Vedantic sciences have discussed over many centuries. And so I call it the 7 stages to health and transformation. And it involves the, you know, from the bottom, it's the stage one is the environmental influence on our physiology, like, you know, our blood are like the rivers, our bodies are like the earth, and our lungs are like the air. We are constantly in interchange with the environment. And
Mm.
our bodies are not fixed and solid. So this whole field of, you know, toxicology and is completely interplayed with our physiology, which is the second level. The second level is everything to do with biochemistry and structure. And we've evolved through, you know, traditional medical diagnostic and treatment into functional medicine, which is looking upstream to all these different metabolic pathways that get deranged and attempting to modulate those.
Mm.
And then, you know, the third level is the so-called the physics of 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 reality, of which you and Carrie and others are deeply immersed. And through the work of Jack Kruse and others, is now, you know, fortunately, this whole world of physics and its preeminence over and above biology is gaining fast momentum, and I think that's a very good thing. And I'm fully immersed in the application of physics into biochemistry and toxicology. So that's level 3. And then level 4 is everything to do with the emotional body. And in our world, the whole world of adverse childhood experiences and early developmental trauma, which play a significant role in the evolution of the individual. Either the person is abused or not all people, but the people who often present with chronic illness are
Mm.
often have abuse trauma or neglect trauma. And trauma is being defined as anything that causes the psyche to go into a state of freeze or fight or flight. It's accumulation. It could be accumulative over time, or it could be a single trauma. And then the fifth level is this the level of the intellect or the mind and the ego, the operational sense of self, and how the ego develops over time with all of its particular values, its internal dialogues, its defenses. And that too has to be understood in a complex system of integrating patient symptoms into their resolution. And then the level 6 is everything to do with this transcendent to physical reality, and which can be experienced through the 5 senses. That we call that, for want of a better word, the level of the soul.
Mm.
Not to use a metaphysical term, but the soul is that deepest part of who you are, you know. your body changes, your thoughts change, your biochemistry change, but to whom are these changes taking place? And that's you, the essential part of who you are. And that has layers and levels too. It's got the levels of Carl Jung's the collective unconscious, and then it's got family systems unconscious, and it's got personal unconscious. So all those layers and levels have to be incorporated into the dynamic of working with patients. And then level 7 is just anything transcendent to that, you know.
Mm.
Ancient metaphysical practices, you know, called it the grand organized design or God or whatever you choose to call it. But it's basically when the physicists 100 years ago came into being, they said, you know, this world springs into being and it's seen through the five senses, but it's actually this world of physical materialism is not material.
Mm-hmm.
It's just a world of energy that gets downloaded into matter. It appears through our five senses to be fixed and real, but there's a reality beyond that, which is, you know, beyond our human understanding. And so people who have spiritual practices can just open to that field of intelligence and achieve information and energy from that field. So those are the layers and levels I work with. And
Mm.
when a patient presents, you've got to ask yourself a whole series of questions. And that becomes the intake and the diagnostic roadmap and the therapeutic roadmap that I use over time to work with patients.
Mm.
It's complex, but I can't think outside of those layers and levels anymore. I just use that paradigm to work with people. But it produces a whole series of complexities that lead to lead to quite a lot of work that goes into that therapeutic relationship because most people present, they just want their symptoms taken away with. You know, the
Mm-hmm.
first level of healing is, I've got this, take it away. And then they go into this whole, what do I have? Do I have Lyme? Do I have mold? Do I have, you know, the list is endless.
Yes.
And then we have to try and dissect that out. And it's complex and complicated. But that's how I start the process, is just knowing that model in my head. And
Mm-hmm.
then when the person enters, then a whole series of drop-down menus start to come into my consciousness as how I'm best going to approach that patient from that complex. And I only see complex patients now,
Mm.
multi-system, multi-symptom people who present with Lyme, mold, mast cell, POTS, disorder. I just the endless stream of symptoms and diagnoses that are out there and which we all interface with from time to time.
And that's kind of what I'm seeing more and more of is it's not someone with just one diagnosis, it's multiple that and that's becoming more and more commonplace. Has it always been like that in your practice where you see multiple diagnoses, or do you think that's more of a common thing these days?
Well, it's definitely as the internet has grown and as people have emerged with much more self-advocacy,
Mm.
and as we've become more alienated from our ecological roots and more gone into inner cities and more exposed to the
Yeah.
various toxins out there, I think it's just exponentially gone through the roof. I mean, when I started out in the 1990s with Jeff Bland and, you know, at the first or second functional medicine conference, we were just, you know, people present with this and they just get vitamin D and probiotics and all was well.
Yeah.
I
Yeah.
have deep nostalgia for those times.
Yeah, I'm sure.
They don't exist anymore.
Yeah, it does seem like the level and amount of chronic illness I mean, that was when I was a child, as the 90s. It didn't You didn't see other kids with autism. You didn't see, their cancer was just kind of starting to kick off.
Yeah.
Uh in that at that time. That's when my mom got cancer. I was, in high school, and a lot of people were starting to get cancer, but these autoimmune conditions and the Lyme and the mold and all these different things that people are presenting with now. You just didn't see it. You didn't hear of it. people were a lot more healthy. Do you think it is, like you said, people in the cities? What role do you think things like non-native EMF, light environment, what do you think those play in the uptick of these sorts of cases?
Oh, I'm absolutely convinced that as we become more estranged from our ecological roots and our deep connection to the cycles of life, and we've moved from, you know, getting up with sun and
Mhm.
being sun exposed and being grounding and getting the circadian biology all dialed in, as we've moved into inner cities under man-made light, like all of us in quantum biology now, it's just overwhelmingly self-evident. I mean,
Mhm.
I can't tell you how many patients that just had, go south in Calgary in winter, just
Yeah.
go to Mexico, and they just come back and they feel fantastic, and they understand this. That people are beginning to understand the role of physics that overlies biology. And
Hmm.
I think it's going to be exponentially sort of reach. I mean, within 3 to 5 years, it's going to be a dominant paradigm, not accepted by everyone, but
Right.
it's
More
going to be
so
out
in
there.
the alternative medicine community, I
Yeah,
think people are starting to. It's funny because I'm not a doctor. I'm not, I'm a practitioner of sorts, but I don't have advanced medical degrees. And I've had a lot of doctors come through my programs and start to implement a lot of things that I teach
yeah,
um, in their practice. And it's funny to
yeah.
see some of them on Instagram now kind of repeating some of the things that I know they got from my courses. I'm like, okay, well, that's good. I want more people talking about it, but it's funny. They're
I, I,
changing
I
their
was I
tune.
was probably one of those.
Oh, I don't know about that.
I mean, what you guys are doing is just, and it's just, it's amazingly sort of, when you go into the minutiae of it and you understand it, it just makes complete sense. There's just nothing that doesn't resonate.
Yeah, that's what it was for me is when I started looking at it really. It's like it's so simple, but it's so overlooked and it's so foundational in everyone's health. And just looking at the way the mitochondria works and that we have all these light receptors,
Right,
and
right.
that's the one thing people are just surrounded. And light can be non-native EMF also. It's a form of light that you can't necessarily see, but it's impacting you at the cellular level. It's just,
Okay.
yeah, the implication.
And I started out with in the 90s and then I did a lot of work with Dr. Klinghardt and others, and
Oh,
we were
yeah.
doing conferences on non-native EMFs in 2005. Magda Havas and all, we were all talking about the imposition of non-native EMFs on health. But what's changed in this whole evolution now with this quantum world is it's not so much getting rid of all the man-made influences, but returning to the ecological roots of day to night cycling, and the fact that we're
Hmm.
so disconnected from that which arose. We arose out of nature, and we are deeply disconnected. And I think many of our mental health issues are just we are, are the fact that we're not dialed into that which is naturally light and dark cycling, which restores just not only our mitochondria, but our entire sense of meaning.
Hmm. It
Uh, we
does.
just we just disconnected from our natural evolution. We are ecologically disastrously estranged from our core self.
Yeah.
And with all our wisdom, we've moved indoors, we've got the refrigerators, we've got the light. I think, as Jack Cruz says, we are headed potentially for another extinction based on
Yeah.
our intelligence that's created you know, all those principles that are taught in quantum biology, to me, they're common sense.
Yeah, it is very common sense, but there's so much money in technology and when you start talking about these sorts of things, people just think it's too simple to actually be impactful. And I think they want the more complicated answer when it comes to their health, and it can be frustrating, but that's why we need more people like you of your caliber talking about these things because you have so much credibility as a professional to
Yeah.
yeah it's
The
it's
other, the other, the other whole thing that changed my way of practicing was also, when Robert Naveau came out with his cell danger response theory,
mm, hmm
that that was revolutionary. I mean, I know Doug Wallace and others have been talking mitochondria, and everything they say is absolutely true. But when Robert Naveau started his work and hypothesized that the the mitochondrial response to the toxic load is an evolutionary and biologically conserved response to get us out of all these things that we're impacting us with, and
Mm-hmm.
that it's not that you don't have mold, you don't have Lyme, you don't have all these individual triggers. What you have is a biological mitochondrial response to all those
Yes.
triggers. And it's that response which needs to be, he uses the word salutogenesis. You have to input signaling molecules into that response, not so much go fight the Lyme, the mold, and
Mm-hmm.
every 50 other toxins that are out there. Yes, you pay attention to them.
Yeah.
It's not by removing them entirely that the healing cycle
Mm-hmm.
is reestablished. And I think what's really changed, I found a practical way to interpret Robert Naveau's work in terms of diagnostics and therapeutics. The whole field of cell membrane medicine has evolved through
Mm.
Patricia Kane and others. And also just looking at the labs. There's a lab out there. I don't know if you're familiar with it. It's the IGL lab from
Mm.
Germany. It measures a lot of mitochondrial parameters. Now,
Mm.
they may be the biological sort of consequences of the cell danger response, not so much the physics of it as you guys, Jack Cruz and others talk about. But you can still read certain things on this IGL test, like mitochondrial numbers, are they down or up?
Ah.
ATP production, is it up or down?
Mm.
Is ADP to ATP translocation happening? Is it being, you can look at those. You can look at the cell voltage. You
Oh,
can look
really?
at, yeah, it's like amazing. And DNA, mitochondrial DNA adducts that are sitting on the mitochondrial DNA.
Mm.
You can look at DNA that's outside the cell where it becomes particularly pro-inflammatory along with
Yeah.
ATP. You can look at phosphatidylcholine levels,
Mm-hmm.
phosphatidylethylalamine levels. You can look at cardiolipin levels. I
Mm.
mean, you can look at the toxic load. You can look at the mold load, the insecticides, the metals, the chemicals. This one test tells you almost everything you want to know about mitochondrial functioning.
Oh,
And
wow.
so, and so when you look at the test and you take the history, it's not my common beef, in which you may have, is I get patients coming to see me and they have the mind that they've been through all the Lyme, mold,
Detox.
microbial,
Yeah.
and they're in the fixed belief that their problems are mold or their
Mm-hmm.
problems are Lyme.
Yes.
And it's very difficult to shake that when we still have that silo medicine sort of thing with one one trigger, one disease, and
Yes.
one treatment.
Yes.
That paradigm has to go. It's so outdated. It's almost
Agree.
ridiculous. Yeah.
Yeah, I
We can't
agree.
do that anymore. Not in this complex world. Yeah.
Let's talk about protein because it is so important that our bodies get enough protein. But a problem I see as a clinician is that people will increase their protein and they will begin to have digestive issues. This is because your body can only absorb protein that's been broken down into smaller building blocks called amino acids. If you cannot break down and digest this protein due to a sufficient supply of enzymes, your muscles and your body will be starving for those vital building blocks. This is why it can be very helpful to take a high quality enzyme. The one that I have been using and trusting myself is called Masszymes by Bioptimizers. Masszymes is a full spectrum enzyme formula with more protease than other commercially available enzymes with 5 different kinds. Plus, it contains all the other key enzymes you need for optimal digestions. You can try it today risk free. Their 365-day full money back guarantee is the gold standard in the industry. You can use my link in the show notes and my coupon code SKW to get 10% off your order. Check out Masszymes by Optimizers. Yeah,
Mm.
because that's what you wipe those things out and then the person doesn't get better. and or they might improve, but then it comes back. That's what I see. It's like you can't just kind of like just kill everything and expect to be better, because that wasn't the problem in the first place. It was the problem of the mitochondria. It was a problem of a poor terrain of low voltage, because these things, parasites, mold, they can't survive with exclusion zone water that is at an adequate level, with voltage that is at an adequate level. They literally, the exclusion zone will exclude these things from the mitochondria, from the cell, and the voltage, they can't survive in those environments. I think that is what is lost on people, that they just think I have to be afraid of everything, that's around me.
No,
And
absolutely.
yeah.
And that the salt voltage dying and the phospholipids dying and easy water, that's an evolutionary protective response of the mitochondria to preserve life
Mm-hmm.
and take you out of danger and wall off the toxins. So to go and detox without restoring mitochondrial health is counterintuitive. And everybody I see is coming in, and the first thing they want is, I need to detox. I need to
Mm-hmm.
detox.
I need the medicines, the protocols, the tinctures. Yeah,
Yeah, yeah.
absolutely.
It's absolutely the wrong thing to start doing. I don't like when I get a patient with Lyme or co-infections, I usually don't even go near them for a good 6 months before I
Mm.
restore as much as I can of the mitochondrial terrain.
Yeah, I think that's so important, because
Yeah.
if you do that, then the condition is typically going to worsen, or the
Worse.
person's going to crash. Yeah,
Absolutely. Yeah.
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 And when you're kind of working on the mitochondrial terrain, how much of that? Obviously, we do light. I'm sure you look at their lifestyle, nutrition. I'm sure it's a holistic approach, right?
Yeah, so when you take a history, you're looking for certain features, which it's a complicated relationship one has with patients, because we know from adverse childhood experiences that people who present with chronic illness generally have a much higher trauma history than others.
Mm-hmm.
Now, here's the biggest complicating feature. When patients have unresolved parental trauma, not seen or not heard, or not good enough parental trauma, whatever's unresolved in that field gets projected on you as a parental figure.
That's tough.
So that starts the dynamic. So the first thing you've got to establish with a patient is one of the first questions I ask patients is, were you seen and validated by your mother and your father?
Mm.
And if there's anything to suggest that, oh, I hate my mother, I hate my father died when I was 2, etc., then I know I have to establish a different interaction with that individual, because whatever's unresolved with that is going to be projected on you at some stage, especially when the going gets tough.
Mm-hmm.
The parent that doesn't see it and the parent that was absent, you are the parent that if you don't respond to the email, if you don't respond to the request for help, all that's unresolved is going to be projected on you.
Mm.
And that then is to all kinds of complicated dynamics. So first of all is to establish what level of trust is there between you and that person. And if there's no trust because they never trusted anybody, the first dynamic to be brought to play is this level of trust and connection through the ventral vagus, Porges's ventral vagal, prosody of voice, gleam in the eye, smile, and safety. And can you go into a parasympathetic safe space with this person?
Mm.
And can you establish some sort of trusting relationship? Now, that's a complicated dynamic, because they don't know you, you
Mm-hmm.
don't know them. And all of these unconscious complexes that were initiated due to the early trauma are going to be constellated at some stage or another. So my first thing is to try and get to know the person first and try and see if it's a relatable relationship.
Mm.
Very often people will give you clues that this is not going to work, and then
Yeah.
it's incumbent upon us to sort of say something about it and do something about it before you go too deep into the cost of the dynamic. Because one thing what patients will hate is, I'm spending all this money,
Mm-hmm.
and I'm not fixed yet, and I was never seen or heard by my mother or father, and you're not responding to my emails. And then all of a sudden you get into this very complex dynamic, and the healing response can't be initiated. You can't move it to the next level. So
Mm,
the first thing I always do is see if we've established a connection in terms of our ideologies and what we're trying to achieve. So it's taking a psychological history and a trauma history is very important. I also like to know people's Ayurvedic typologies,
mm,
and I also like to know their attachment styles. And I also like to know their Myers-Briggs typologies because everybody's very different along those typologies.
mhm,
A sort of extroverted, sensate, thinking, judging type is a very different individual than a introverted, intuitive, feeling, perceiving. And so one has to adjust one's own internal state to meet the typology of the individual.
mm.
So I always find the Ayurvedic questionnaires, the Myers-Briggs questionnaires, and the attachment style from Diane Poole Heller's work very important to try and establish a working relationship with that person.
Wow.
And
So,
then sorry.
oh no, go ahead.
Yeah, no, then I just start to take a history, and I just take a history along a specific timeline, just like the functional medicine teaches,
Mm,
antecedents, triggers, and mediators. You try and establish a timeline as to what initiated this cascade of events to create mitochondria. Because, I mean, I don't know about you, but mitochondrial distress is at the root of most things right
oh
now.
yeah,
And
100%.
I don't even, that's my working hypothesis. And then I've got to work backwards to find out what were all the antecedents, triggers, and mediators that led to the mitochondrial incompetence.
Yeah,
So
that's,
sorry.
oh no, go ahead.
No, then I just take this long history.
I think that's so important to understand, like to understand the story. That's the thing I learned. I did Dr. Tom Cowan's new biology clinic, and that's the main thing I learned from Dr. Cowan is just to talk and understand the story of the person. And it might not be something obvious that triggered whatever issue that they have that's going on. They're autoimmune. There could have been a family trauma. There could have been a life trauma, an event. And then all of a sudden after that, that's when all the problems came. And it didn't even have to be, I moved into a home with mold. I mean, that
No,
could be part of the story, but it's so, I think that that's where a lot of medicine misses the mark is that it doesn't really get to the person and it doesn't see them on these different layers and these different parts of the actual person as well.
absolutely. Yeah, one of the great tragedies of traditional medicine, mechanistic medicine, is we don't see layers and levels to healing. We just see people as mechanistic entities of biochemical abnormalities, and we've got to find a drug or a herb to fix the whole.
Mm-hmm.
That model just is we throw that out the window. We very complex interlocking human beings with internal realities and social connections and environmental. We're very too complex for that model anymore.
Yeah,
And the
100.
other thing is, most people don't heal until they have a new story to tell.
I love that you said that. Yeah.
If they don't get some immediate insight as to the narrative, and one of the great transitional points for me, besides establishing some form of hopefully some trusting connection with the person, is through education to show them what could possibly be underlying their condition. So, education and salience is extremely important, I think, in the therapeutic relationship. So in my treatment sessions, I do 3 hours teaching my patients the biochemistry and the physics of what could be wrong with them, as
Mm,
well as the psychology and the trauma and the different stages of life they may be in and the different typologies. That all has to be woven into a relevant narrative. And I've noticed that when people get diagnoses, label, I got
mhm.
lupus, I got MS,
Yes.
that
Yeah.
freezes this body and the system into passivity.
Hmm.
Person becomes passive. I've got lupus, I've got MS.
Hmm.
And then they project their will onto you. Now you
Yes.
fix it.
Yes.
I got a diagnosis. Do your magic. I don't want the drug. I don't want the biologic. I want the herb. And so they got the diagnosis, they've shut down the intent, they've shut down self-advocacy, and everything goes silent into that system. And then you struggle to find meaning in that dynamic. And all symptoms in my mind are teleological. They point towards where you need to look. And
Hmm.
some patients are amazing. I mean, as you know, some they really are at a higher level of ability
Hmm.
and ego strength to take on the deeper inquiry that's necessary often to change the story around why they presented in the first place. But other people aren't, they don't
Yeah.
have the ego strength. They have fragile defenses, or they're very highly resistant with lots of projection of will. And that patient, you sweat. It's hard to work with
Hmm.
them. And
Yeah.
whenever you draw associations, they just shut it down, or a
Mm.
member of their family says that's just nonsense, and
And they listen. I mean, that's so tough. I've got a really wonderful woman in my group right now, and she's been around for a bit in my around my work, and she's unfortunately had a stroke, and she's really trying hard to recover, doing a lot of things right now, and she's got staying with family members that are watching her do grounding, and she's starting some molecular hydrogen inhalation, and they're just kind of poo-pooing everything that she's doing. And I'm like, you can't listen to that. If you want to get better, you can't you can't allow that to infiltrate what you're doing right now. You have to be, don't tell anyone. If you're gonna come up against that sort of thing, people say what you're doing is stupid because you're going outside grounding. They just don't understand how the body works on that level, and they don't need to know, because that can derail somebody who's very fragile and trying to heal.
it's epidemic and it's a problem. I mean, the dynamic between healers, doctors, patients is it's fraught with complications right now, and I'm not quite sure how one evolves through it because I mean, I was just thinking before I got on the call with you, I would love to be optimistic about, and 80-90% of patients we see, they do extraordinarily well if they show up
Mm-hmm.
and they have intent to heal and
Mm-hmm.
they raise health as their highest value and they're curious and they read and they have the support of loved ones. But the other 10-20%, not even 20, maybe 10, they are they were never seen, never heard. They fear that they will be abandoned yet again by you. And
Mm-hmm.
when they start having their early childhood demands not met, they start to project all over you and gaslight and start to make you wrong for the fact that they aren't 100% cured and they've spent all their money.
Mm-hmm.
So that dynamic is very complicated. And a lot of patients, a lot of practitioners are getting out of this field of treating complex patients because of it. It's just too exhausting.
Oh yeah, it is very hard.
Yeah.
Yeah. And a lot of, children now are sick, like my daughter, that they can't speak and they can't advocate for themselves. And practitioners just don't know what to do. And it's all of them, that are like my daughter. They all have Lyme, the mold, the parasites. They all have SIRS. They all have these things. And, I'm kind of the one in our community that's doing things a little bit differently. And it's helping my daughter. And it's hard to get the parents out of the mindset that the kids need to constantly have something thrown at them, medications, or not even medications, but supplement protocols. They'll come to me with these like 60, 70 different supplements they're giving their kids over the course of a day and detoxing. And I'm like, that's not the answer for these children. And a lot of them, like you mentioned, they've had something traumatic that's happened that kind of has kicked off this cascade of illness for them. And it's like there's so many layers to it, I think, that it can be difficult for practitioners. I've had practitioners tell us, the good ones have said, she's too above what I can help you with. They just are honest about it. But it's multi-layered and multifaceted with people.
Yeah, and fortunately the 80%, now 85% who can rise to the challenge of raising health as their value and do what's required, their success is amazing. It's
Hmm.
what keeps one doing what we do. It's just,
Yeah.
and they've gone outside of the consensual reality paradigm, which is, they call that centralized paradigm.
Yeah.
But
Yeah.
and they just applied it, and they found joy in it, and they found meaning, and they get results, and they just move through this complex territory with relative ease.
Yeah.
Then the other ones get stuck, and then you sweat.
I think it's just the identification with the diagnosis or with the particular pathogen. That's what I'm seeing the most of. Um, the people that I'm just like, if people come to me, I have this and I have that and I have this and I have this and that. It's like this long list of things that they have and they've identified as this person is tough. It's a hard conversation. That's where I'm like, you need to sit with someone one to one who can really work through this with you, because they have to create a different identity for themselves that isn't the illness.
The one of the cardinal dynamics that I've had to employ over time is when a patient comes to see me, if I rise up into the hero archetype of the all-knowing, all-seeing doctor, and they the passive, all unknowing, labeled patient, that's a very imbalanced dynamic.
Mm-hmm. Mm-hmm.
So unless I can see the woundedness and sickness in myself and the health in the patient, and then balance that dynamic, you very often get stuck in that sort of that cantilevered dynamic where they all sick and you all healthy. And if they just follow what you have to tell them, they're going to get better. But that creates a mismatch in the limbic resonance between the patient and the healer. So you have to try and often appeal to the healthy part of the patient
Mm,
while
mm,
trying to address the symptomatic part. And you constantly got to talk to the healthy part. But the healthy part will often revert to the very wounded, sick part in order to get what it needs. And so this dynamic becomes very complicated sometimes.
yeah.
But seeing a patient as all healthy becomes at some stage in the dynamic. I mean, I've had patients move to Calgary for a year to be
Mm,
treated, and they get through it, but then they become so
dependent.
medicalized.
Mm,
But I have to sort of say, look, your next phase of healing is move to Costa Rica and forget about everything you've done here.
yeah.
Go surf, go
Yeah.
stop identifying with all these pathologies that are signposts along the way, but they're not your true self. Your true core self is something far more magnificent.
Mm,
And who are you, and what are you here to do? There's
yeah.
different there's different there's different stages of healing. That one is just to get rid of the symptoms. The other is to bring your resources to help build a mind body program. And the third is to live at a stage of maximum wellness and joy and meaning. And the fourth is when you transcend all that and you don't identify so much with your physical body, but something transcendent to yourself. And that's a very rare state, but that's another level of healing that's possible.
Mm,
Most of us enter into this healing dynamic through symptoms and through functional medicine, and we have to try and stay in that level 2, the biology, to try and figure out symptoms and what to do with them. But when people get a new insight and they get a new narrative and a new story, and they start disidentifying with their diagnoses, and when the mitochondria and the cells start to go through the cell danger response back to the healing cycle, and there's cohesion and cell-to-cell signaling, all of a sudden this life force gets released and the individual starts to flourish once again. And those
mm,
are just miraculous moments, which we've all had with our patients. It
absolutely.
happens enough for us to keep going.
Yeah, I know it's hard. It's hard. I've said I don't do one-to-ones because I've got a medically complex child that I'm constantly doing a lot for, and I've got a 19-month-old son, and it's a lot emotionally to take
That's huge.
on.
That's huge.
Yeah. And I learned quickly when I was doing a lot of one-to-ones. I stopped doing
Oh,
one-to-ones.
you did you? Yeah.
I stopped when I was pregnant with my son halfway through the pregnancy because I noticed it was just really impacting me.
Yeah.
Um, it's hard. It's really tough.
Yeah.
I have people that I trust that are uh, like Dr. Sarah Pugh and Carrie Bennett. They still have time and bandwidth, and I may go back to it eventually one day
Yeah.
to do the one-to-ones. But it is it's a lot, and I realized in that people need a therapist. As much, if not more, and someone to help them work through the somatic part of their illness as they do um, protocols and treatments and physical things that they can do. It's that emotional side.
Oh, the well, I don't work with patients unless I can have some insight into those dynamics. So we
Mm,
do neuroquant MRIs, we do
mm,
QEEGs, we do heart rate variability, and we look at the capacity of the individual to self-regulate.
mm,
And so we objectively measure that. And then I won't treat patients who aren't self-regulating in the clinic while they're receiving intravenous cell membrane medicine
mm,
because and the self-regulation strategies are everything from biofeedback to neurofeedback to we're using a lot of some primal trust. We've sort of
mm. Yeah,
moved away
nervous
from
system retraining. Yeah.
the Gupta and DNRS quite a bit, but primal trust seems to resonate with a lot of people. And
Okay.
then most of my patients are working with somatic experiencing physicians or ISTDP or internal family systems. There's different therapies for different people's dynamics. And I find over the years, I've sort of got a little bit of experience that, oh, you do well with the SE practitioner. Oh,
Mm,
you do better with CBT, which I don't, not so much, but or you do better with ISTDP, which challenges the defenses of the individual. Or no, but internal family systems. That part of you is sabotaging that part of you. You need to talk, two parts talk to each other.
wow.
So we work with lots of different, without therapists, I'd go nuts,
Oh
Yeah.
yeah. Yeah, because it's so, I think the somatic experiencing and doing that work for myself was really instrumental in getting pregnant after multiple losses and trying pretty much everything on the standard this is going to help your fertility type of protocols. None of it was working until I did all the quantum biology, circadian biology, and there was the nervous system component that had to
Yeah.
be addressed. It absolutely did.
Well, the cell danger response, the shutdown hypermetabolic response, is
Mm,
exactly the same correlative to Porges's,
mm.
dorsal vagal shutdown.
Yes.
And so if we don't coax that system back into some sort of relevance and some sort of dynamic vitality, there's no returning to the health cycle. So
So basically, in simple terms, if you don't work with this aspect of the person and in a systematic way that works for them, then you can do treatments, you can do detoxes, you can do intravenous, things to support them, but it won't work. Is that kind of what you're seeing clinically?
well,
Won't work as
another
well.
So when you're working with layers and levels, if you're just inputting into the biochemical layer, the chances of success are very limited in my. I mean, simple stuff, no problem. The complex illness, no. You can't just work at the physical level.
Mm-hmm.
So I usually start with, in taking the history, looking at inherited family trauma or early developmental trauma. And the one thing that I do, I refer all my patients to a colleague of mine called Mark Lin.
Mm,
He's wrote the book called It Didn't Start With You.
mm.
And he does one-on-ones with patients looking at their inherited family trauma
Okay.
and their early developmental trauma, particularly looking for breaks in the bond between the individual and the mother. Because the
Mm,
mother of the individual is where it all sort of, where the rubber hits the road. If there's lots of breaks in bonds between the mother and the child, and the mother and the mother's mother and the genealogy above them, you'll see this whole system has these interrupted bonds where the flow of love and the flow of order and the flow of mitochondrial sort of vitality is, as we know, the mitochondria come from the maternal line.
Mm-hmm.
That gets interrupted. There's so many breaks in the downstream biological systems that unless you try and shed light on those early entanglements, what happened in that system, what was the epigenetic transference of the trauma, how was the child seen and held by the mother in the first 10 years of its development. If you don't take that history and work with it and give it homework, I find that biological work is not as robust. In
Mm.
fact, I almost refused, I refuse to work with most people who won't do the family systems and early developmental trauma work. And it's often that which initiates the healing cascade that then sort of unlocks the HPA axis and the mind-body system to be more receptive to new inputting signals, and then reestablish the cell danger response back into its healthy dynamics. So
Wow.
family systems work and early trauma work and amygdala retraining, they trickle down into biochemistry, as does physics. They all trickle down. The body
Yeah.
is the final resting place of an entire experience.
Yeah. It
And
absolutely is. Yeah.
then let's we look at the inherited traumas and the early traumas and the mental field and the defenses. Those have an effect downstream. If you fix the mercury toxicity, it has no effect on the higher levels of healing, you know.
Mm.
And so
Yeah.
you can't work in reverse. And so I don't chase biochemistry without doing that other inner work. It just doesn't, it's not successful. And
Yeah.
you just don't get as much of the results. And it takes time. That's the other thing.
Mm.
When you're working with complex systems and people, it takes time for them to get the intellectual and physical and somatic experiences that then create the new narrative. And
Mm.
then while they're working away at restoring mitochondrial health and cell membrane integrity, it takes 6 months to a year to get anywhere with any real meaning. And
Mm.
for many people, that's outside of their expectation. They really do want something.
Quick
Yeah. And they want a diagnosis and they want something.
to
And you
take.
work, yeah, and they get angry with you when you don't participate in that sort of dynamic, because it's not where the healing is. The healing is in a transformative, relevant, health as a highest values. It's a whole complex movement that has to take place within the patient and the practitioner in a sort of co-directional way. It's a
Mm.
dynamic. The healing dynamic is complex and it needs respect and needs time.
Mm. Yeah. What would you say to the person maybe that has the chronic illness that's listening to this, or has a family member with the chronic illness that's listening to this and says, this just seems too overwhelming and too complicated. And I'm just, and they kind of go into shutdown mode when they hear a conversation like this, because I think it's so drastically different than what's being had out there in the alternative health space.
Well, the without being facetious, I hope I'm not, but the good news is I've written a book on the layers and levels. I'm trying to, like you, I'm trying to make myself more comfortable within this complexity and not work as hard
Mm, yeah.
because it's exhausting. And I've
Yeah.
got to the stage in my life where I want to teach what I've learned, to practitioners and to
Mm,
patients. So I've created this 7-stage model, and I wrote the book 10 years ago. I'm just modifying it now. Now, now that quantum biology emerged as a dominant force. So I'm rewriting chapters. And so I'm going to try and provide a curriculum. I call it the new medical curriculum.
mm,
That's the working. It's a new, like Tom's, the new biology, the
biology.
new
Yeah.
medical, nothing but a bold statement, the new medical curriculum. And I'll try and teach it in a systematic way so that people aren't overwhelmed, because it is overwhelming. When you look at if you look at my, I don't know where it is here. If you look at here it is, somewhere here. I've got this 7-stage map, and this is just it's layers upon levels of complexity of different
Wow.
stages and different experiences, different anatomical variations, different sciences, different diagnostic methods, different treatments. So I've tried to lay this all out in a systematic way
Mm,
and then try to teach it so that when a patient looks at it, they'll go, oh, I should see my oncologist and not my psychic
mm,
because I have this particular problem. So I'm trying to orientate patients to their complexity without making it too complex.
mm,
And that's what I'm spending the next year doing, just trying to get that new curriculum out so it can be used and taught,
mm. Absolutely.
like a roadmap without falling apart and going into further cell danger at the sheer volume of all the information out there.
Yeah, I think that's the thing for like I said, that person who might be listening that is really struggling is that they're just struggling with information overload. And I
Yeah.
think when you just try to dive into these specific conditions from this biochemical model, it is daunting and it is
Mhm.
discouraging and expensive. And it's really scary because it's like, well, you have to do all these different protocols and may or may not work. And I don't know why, we don't know why it may not work. You may get worse. And it's just a
It's
broken
very,
system.
it's very complicated. I mean, I feel terribly for patients when they get into this sort of chronic ill health issue,
Mhm.
because I've seen, with all due respect, everybody tries their best, but
Mhm.
you'll get somebody who comes with, mold,
Mhm.
and they've gone the SIRS protocol and they're on binders.
Mhm.
And then you look at their you look at their lipids, they're minus 100 on their total
Right.
lipid score. And
Right.
every single fat in their body's been bound up in the cholestyramine.
Mhm.
Or they've got such terrible POTS that's never been diagnosed. And
Yeah.
so here they're trying to get blood flow to their mitochondria, to every cell in their body, but the whole autonomic nervous system is just not cooperating.
Mm.
So there's a hierarchy of diagnostics and therapeutics that have to be sort of followed. There's a sort of checklist.
Mm.
And I try and go through that checklist as best as I'm able to, you know, what is the mental health? What is the early developmental trauma? What is the typology of the individual? Is there a connection? Is there trust? Have they raised health up as their highest value? Do
Mm.
they have POTS? What does their brain look like? What does their biochemistry look like? How are they connected to the physics of healing? Do they feel related to? Do they feel meaningful? Do they have meaning and purpose in there? Or are they just a collection of symptoms that there's no organizing principle? So you try and work through these layers and levels and create order and structure to their therapeutics. And that's the new medical curriculum, is trying to organize that so they have a system to follow.
Mm.
It's like
Yeah.
a hierarchy of diagnostics and therapeutics that's not just scattered everywhere.
Yeah. We're not just going to throw everything at the wall and see what sticks, and then the person is suffering still, if not worse, which I really hate to see. Yeah.
And they've lost more trust in that which they never trusted in the first place. And
Yes.
then, $30,000 poorer.
That's what who guy get messages me and emails me. I've already spent all this money. I've already spent all these things. Why should I trust you? And I'm like, well, because I'm not. I'm just basically telling you to go outside more. Like what I'm teaching you is just going to support you on a foundational level. It's not going to
Sure you.
interact with anything that you're doing. It's going to help. It's going to help build that resilience
Yeah,
a bit more. The things that I talk about. So
yeah.
yeah, it's tough though.
It's a very common, and when I was thinking yesterday about talking to you, I didn't want to be depressed about it, but I'm just admitting to the the complexity and when I started out doing this 7-stage model 15 years ago, it was much easier to do. And now,
Yeah.
as people get more informed
Oh
and
yeah.
more, and unfortunately, there's something, I don't know what this new trend is, but there's a tremendous sense of entitlement that's
Yes.
crept into, and it's this immediate gratification that if I email you and you don't get back to me, and it is a very crazy, something very odd going on in this doctor-patient relationship, and it's not pleasant, you know.
I agree. Yeah, I have the same. I was just having the same conversation this morning with someone who helps me manage my emails because I've had to really just, I don't have time to answer emails from everyone who reaches out to me anymore. I don't have the emotional capacity. I don't have the time. So I have someone helping me and people get really upset. I mean, I do have a community people can join and I always answer the questions in there, but yeah, there's a lot of and I say it with compassion is just like a lot it's not helping anyone at all to expect immediate gratification and results and um it's just an interesting thing that's going on for sure.
It's a very subtle dynamic too, because you don't want
Mhm.
to become patriarchically punishing.
Oh,
You're trying to stay related to the complexity
yes.
and still see if you can meet their needs.
Yeah,
Uh, yeah, but so it's incumbent upon us as practitioners to set our own um, parameters for how we wish to interact. And I'm finding I'm having to get tighter and tighter and tighter
me too.
in terms of just sealing any loopholes that may get people get around when
Mhm.
when they want to be seen and heard now, you know.
Yeah, exactly. Yeah. Yeah, it doesn't help them either because as long as you're putting and people like you and I think we really want to help people and I know I do a lot of free as much free stuff as I can, free content, free guides, free podcasts and YouTube and I write a lot and I do all that for free and it's because I want to help, but we're also human beings as well with our own complexities and
Absolutely.
our own energy, our own families that we are trying to be healthy in those dynamics as well. And so you do
Absolutely.
have to consider all those aspects. And again, to kind of people are searching out these different viewpoints and these different ways of looking at health, and it's crucial that we keep doing the things that we do, but we can't allow everyone to just have instant access to us on that personal level. It just would, yeah, it's just not healthy for anyone, I don't think.
And solve complex
Mhm.
complex dynamics on a turn of a dime, as if it's just, I just take this and you'll be fine. It's not
Yeah.
like that. Yeah.
Here's this protocol. Just do this exactly to the letter, and everything will be correct again, and you'll feel
Yeah.
better. And yeah, it's
And it's also you've got to it's you got to have appointments, and okay, what's worked in the last 3 months or 2 months. What symptoms, residual symptoms do you have? What's disappeared? What's residual? Now
mhm.
let's enter a dynamic as to what's next in your treatment. But many people are fabulous with that, but some people get really resistant and really, that the symptoms haven't disappeared overnight, and yet they've spent this money, and you the 20th of the long line of disappointments. Yeah,
Yeah. Yeah, it's tough, but I do think overall, even though it can be from the vantage point that you and I sit at, it can be a lot on your energy. And I know I'm a really empathetic person. That's the other reason it's hard for me to do a lot of these types of interactions because I end up sometimes taking on that energy of the person who's really sick and just feeling like I want to help them. And I just hurt, it breaks my heart. Um, it's, yeah, but they have to see that again, there's these layers of healing, that it's not an overnight process, and that sometimes symptoms don't go away immediately. Like with my daughter, we've been on this kind of alternative way of dealing with all the things that she's got going on, all these multi-diagnosis. And it's been like 3 steps forward and 2 steps back, and 3 steps forward and 2 steps back. And it's can be just so exhausting emotionally and physically. But you have to continue to count the wins. You have to
yeah,
continue to say, well, this is no longer like with her. She
yeah.
hasn't, knock on wood, been physically aggressive towards any of us, which is huge in months because it had been years of this kind of terrifying physical aggression that she was having with all of us. And she hasn't had, knock on wood, none of it since last year, which is miraculous, and so yeah, it's not this you just go on this upward slope. When it comes to healing things,
It's,
you go up, you go down, you up and down, and you count your wins and you continue on that positive trajectory as much as you can.
and you often need a collection of practitioners on your team.
Yes.
People who have a specialized niche. And like I recently developed back problems, and I went, you do the normal MRI, and then all of a sudden I thought, let me just go and work with this osteopath. And all of a
Mm.
sudden the osteopath's moving things around and using, shock therapy, and all of a sudden, back pain's better. So, you go to your orthopedic surgeon, you go to your physio, your
Mm-hmm.
acupuncturist, but then you just figure out who to go to.
Mm-hmm.
And then all of a sudden things start to click, and there's coherence in the system again, and anatomy
Yes.
starts to click in. So a complex healing team who's not, in our Canadian healthcare system, because it's paid for by the government,
Yes.
we just get the traditional N squared, D squared medicine model, which is you got this, take that.
Mm-hmm.
And many of the people in the centralized system are highly adverse to anybody outside the system.
Mm-hmm. Oh
And
yeah, it's
they
like
have,
that here too.
is it, yeah, they have no shame in just saying terrible things about other
Mm-hmm.
practitioners to the
Mm-hmm.
patient.
Oh yeah. Oh, I know. And then what does that do to the patient? Like that's my lovely, wonderful woman who just had the stroke, unfortunately. You know, when you have other practitioners or other people just saying, oh, that's nonsense, that's quackery, even if there is an evidence, scientific body of evidence to show that what they're doing or the protocols they're using have been very successful with other people, the patient still hears that, and then the treatment may not work as well because it's created a doubt in their body, and that coherence, that resonance can't happen for that person on a cellular level if they have this block of like, well, it's quackery, it's it just, yeah.
It's
Yeah.
a huge shortcoming. I don't know why we as medical doctors became so assured of our own knowledge base to be the only knowledge base. I don't know where that crept in, but it's ubiquitous and it's terrifying, you
Yeah.
know.
Yeah, it is. It really is. I mean, it happens everywhere. It happens in the nutrition space. It happens uh, anywhere you go. Someone's always out there trying to discredit someone else to make themselves look better. And, I just try to stay out of it as much as I can, away from it, and say, okay, well, then don't drink structured water. Don't do grounding. Don't do it then. If you think it's quack, don't do it, So
Yeah,
yeah.
it's hard. I mean, we've spoken about the negatives of this dynamic, but I mean the wins and the tremendous resolution of complex symptomatology that does arise most of the time is very encouraging. And
Yes, I agree.
I do think this new curriculum that I'm going to put out there will be a bit of a template for others to look at and to negotiate their own dynamics with, hopefully without becoming too stressed by the multiple possibilities.
Mm, yeah, I think that's so important, and I hope that this reaches the right people that would be interested in looking at something like that, because we need more people out there willing to look at health kind of in this different light, instead of just stuck in this biochemistry, or just only in nutrition. Uh, it's a whole approach that needs to be really addressed, I think. And I do get, my the people who help me with my emails, I do get these miraculous stories of healing, and the people that I've never even talked to, they've just bought one of my courses. And I had this woman that hadn't been able to get out of bed in a year. And she did the very, very simple things that I kind of laid out in this
Oh,
program. And
beautiful. Yeah,
she went on the first vacation she's been on in
yeah,
years,
yeah.
enjoyed it, and had a blast. And, it's stories like that. That was clearly she took this information and ran with it, but she also believed that it could work. And she also didn't see me as the guru. It was like she could take the information and use it to help herself heal, to empower herself. And I think that's the overarching message that I want to get out there to people, is that, you are the one ultimately who gets to hold the cards here. It's not the doctor, it's not the practitioner. They can guide you, but you are the one who holds the cards.
Yeah. Patient advocacy is the new language, and it's fraught with, it's both necessary, but it's also fraught with complexity, because of that very thing we spoke about, the people tend to get over identified with
Over identification
label.
is a
Yeah,
big issue. Yeah,
big.
exactly.
Yeah.
Yeah. Yeah. Hopefully some of that will, I think it's just kind of, things swing in such a crazy direction. Like in the 90s when I grew up, everyone, no, my parents sent me to Weight Watchers and I got called fat. And, now I feel like kids are probably still mean and they're still bullies, but you know, if a kid is overweight, instead of trying to help them, a lot of times the parents are just like, it's not the same way of looking at things as what used to be. It's kind of
Right.
it was a lot more harsh back then,
Yeah, yeah,
and
yeah.
they get, they'd have the things in gym where you had to do these like pull-ups and push-ups and running. And I was always like the last place, purple face, sweating, crying, and then they would weigh you and they'd call out the number in front of the class. They would never do things like that these
Oh, yeah,
days.
no.
It's kind of swung the other way. And I think this like over identification with diagnoses and people kind of, oh, I'm diagnosing myself with this, and this. I think it's just an overswing, and hopefully it will correct. Hopefully there'll
I,
be a middle ground at some point.
well, when people advocate for themselves and do it reasonably and sensibly,
Mm.
and have, hopefully with your curriculums that are meaningful and make sense. I mean, I do think that there's a possibility for evolution and on the healing front, but going down these rabbit holes with this emergent functional medicine sort of mushrooming effect,
Mm-hmm.
it, I think we've got to get beyond functional medicine principles. We've got to evolve past them. They've led to their solutions, but they've also led to lots of more problems than
Lots. Yeah,
yeah.
agree 100%.
Mm.
Well, I feel like we could continue talking, but I just really appreciate all of your time today. I know you run a busy practice. There's so many people that I talk to that are not even really practicing anymore. They're just kind of doing books and speaking, but you are in the trenches, in clinic with patients daily. And so I know
Oh,
this was a lot for you to take time out of your schedule to come on and chat with me today. And I really do appreciate that.
pleasure, Sarah. Pleasure.
Yeah. And you have the book that you're kind of reworking. What other things are you working on, or how can people find you if they want to get some of your work or learn more about your clinic?
Yeah, so my clinic is the Hoffman
Mm.
Center.com.
Okay.
My Instagram's admin, and yeah, it's Bruce. The Hoffman's my site address. Blogs and things I've posted over the years. There is a video on my website called How to Treat Complex Illness, which is an hour and a half lecture I gave to the ICI conference, and I explain this layers and levels of healing in much more detail on that.
Mm, wonderful. Well, I'll make sure to link all of that in the show notes for people that so they can go and check that out. And again, it's just been an absolute pleasure having you
Thank,
on the show.
hey, thanks, Sarah. Thank you very much.
Thank you. Thank you so much for listening to the Evolving Wellness Podcast. Just a quick little reminder, this is not medical advice nor meant to be taken as a substitute for working one-on-one with a healthcare practitioner. And if you enjoy the show, please head on over to Apple or Spotify to leave the show up to a 5-star review. If you're over on YouTube, please leave us a like, leave us a comment. I really appreciate you for being here, for listening to the show, and your support means the world to me as I continue to try to pull guests from around the world to bring you informative content to empower you to make decisions about your own health. Thank you so much for being here, and I look forward to seeing you again next week.